Cases of measles are on the rise. 11 new cases discovered in the Grand Erie Public Health Unit. While there haven't been any cases discovered in the Guelph unit, we do have Dr. Nicola Mercer, the Medical Officer of Health and CEO for Wellington-Dufferin-Guelph Public Health, joining us today to talk a little bit just about measles and share some more information for people out there. Thank you for joining me today, Dr. Mercer.
Well, thank you for having me.
Well, first off, I just kind of wanted to discuss what is measles?
Well, that's a great question because for many people out there, it's sort of an old disease. Well, maybe we don't get measles anymore. But actually, measles is a virus, a very contagious virus that can make you extremely sick. Now, for most people, especially if you were born prior to 1970, you may have actually had measles as a child, so you are immune. But since the late 60s, early 70s, we have been vaccinating for measles, and we have a vaccine that's extremely effective for preventing measles. Unfortunately, though, not everybody chooses to vaccinate themselves or their children, and that is why sometimes we see measles outbreaks and cases of measles. And right now, that's what we're experiencing in Ontario.
If someone hasn't been vaccinated, what kind of concern is there if they do get measles?
Well, measles is so infectious that you actually only have to be anywhere in the vicinity. So for an example, if somebody was in a Walmart, a very large store, and they were infectious with measles and you are not immunized, you could get measles. You don't actually have to be close to a person. That's how infectious it is. And then if you get measles, you can be really sick. And there are some complications of measles that can occur afterwards. Ear infections, lung infections, eye infections, and these can cause some longer term issues. So measles is not to be taken lightly. It's not just a rash. It is a very serious illness that in the past has killed many, many children around the world.
Definitely something you want to avoid. I know you say it's kind of, you don't have to be super close to someone to contract it, but are there signs that you can kind of look for?
Well, by the time a person has measles and is showing symptoms, it's really too late because probably that person has been walking around spreading the measles virus even before they knew they had it. So what symptoms would we get with measles? So the first thing people usually have is a low-grade fever. They're not feeling well. They may have a little bit of a cough. They may get some red sore eyes, what we call conjunctivitis. So they may go to the pharmacy to see if they can get something for their sore eyes. And then you will get a rash that starts usually on the face and spreads across the body. And measles can make you quite ill for a very long time. So if you have not been vaccinated for measles, or if your children are not vaccinated for measles, I really want to encourage you to rethink that because measles is a very nasty disease, and we are seeing increasing numbers of measles, not just in Canada, in the United States, around the world, and it's really now going to put you or your children at risk if you are not vaccinated.
And I know you said you haven't seen any cases in Guelph, and these are in the Grand Erie Public Health Unit, but is there the possibility that these cases could kind of make their way across the province?
Oh, absolutely, because it's so contagious. So it just takes, for example, you're driving through an area where there's a measles outbreak, and you stop. Maybe you stop to get a coffee, and what if somebody in that particular area had measles and they didn't know it, they were infectious? We have seen this particular outbreak jump to other parts of Ontario. So we have had cases, not just in the Grand Erie Public Health Unit. And also, we've now had a cluster in Manitoba as a result of gatherings that are connected to the outbreak. So you can see around the world, just think about what happened recently, when we've had both SARS and we've had more recently COVID. It starts in one area, but if people are not vaccinated, it can easily spread through populations, finding people who are not immune.
Well, definitely important information to know. Thank you, Dr. Nicola Mercer, for sharing that information with us and joining us today.
Thank you for having me.